Hi, my name is Roman Rodriguez, and I'm in the Comm 1010 class at Slick. This is my speech one, so here we go. So for my interview, I interviewed Amanda Pope. She's an EMT at the University of Utah Hospital in the emergency room. She's been an EMT for about 4 years now, and she said that she really loves being an EMT. And the reason I chose to interview her is because I plan on being a nurse. I'm in nursing school right now, and I'm not a CNA yet, but I do work at the hospital in distribution. And my original goal was to plan on being a CNA, and actually, this interview changed my route to becoming a nurse. So she actually suggested that um, it's better to be an EMT if you're going into nursing because you get to do a lot of the things. You get to do everything that the CNA does, but the EMT can do a lot more things, which gives you much more experience and hands-on training on the job for when you're an actual nurse. So for her schooling, she said that she did the Slick program over the summer, and it's a 10 credit hour class. And she said that the reason she did this is because she looked at the Slick passing rate for the EMT course, and it's the highest in Utah. So she obviously wanted a good program so that she would most likely pass and get good education. And she said that it's also one of the cheaper options as well compared to like the UEMT course. And yeah, that's how she got her education for her EMT. Um, some basic things that she said that she does every day on the job is when she gets there at 7 a.m., they have a 7 a.m. huddle where the EMTs that are coming off of work inform them on what's going on and what patients need certain things and how much attention they need and things like that. The other basic tasks that she said that she does is she draws blood, she starts IVs, she cleans wounds, especially with the trauma victims, and which she also said that the trauma patients are her favorite, most exciting thing to do because in the University of Utah Hospital there's 4 trauma bays, and she said that to be a trauma in the trauma bay, you have to have a certain criteria to match uh, to fit into the trauma bay. Um, she said that she didn't expect that she would draw blood. She thought that she would be doing things mainly like taking vitals, but she said that drawing blood is one of the main things that they do. Um, she said one of the ways that if she's getting stressful in a stressful situation, is that she takes her time, she slows down, she just thinks straight, she calms down, and she does one thing at a time, whether it's one patient at a time or one task. She said that that's a really good way, and she also says that she likes to prioritize things, so not putting too much on your plate, but just doing things in a certain order to make it fit which important things need to be done first. Um, some of her likes and dislikes is that one of her favorite things that she likes about being an EMT is that she knows that she helps save a life that would ordinarily have been lost. Um, some things that she doesn't like is she didn't expect that much bed bugs to come from patients. Um, so she often has to shower them down, which is kind of funny because they said that they use something sort of like a hose and scrub them down to get rid of the bed bugs so that they don't infest the beds in the emergency room, so they don't give them to other patients. Um, she explained to me the difference between the medical side of the emergency room and the psychiatric side. The psychiatric side is called the Gold Pod area, and that's where they have a lot of the people with more mental problems or substance abuse. She said that the Gold Pod can be slower. It's a lot slower and more relaxed pace. But if they have a full Gold Pod and it's pretty busy that day, then it can be a lot more hectic than the medical side. So it's not an in-between. The medical side is like a more leveled out playing field, and then the Gold Pod can be either really relaxed or very intense and stressful. Um, she said that in the Gold Pod area, there's a lot of the homeless population that come in and say that they have certain symptoms that the emergency room would mean they have to take them in no matter what. And they said that the homeless people say that because they need a place to stay, not because they specifically have those symptoms or thoughts. They said that some of the symptoms include that they say that they're homicidal or suicidal, um, so that they have to take him in and treat them. Um, So yeah, in the Gold Pot area, she said that there's a lot of bed restraints. So if people are getting kind of off the rails, they have to put them on bed restraints so that they can't get up and attack the nurses. She said that has happened a couple times. And they also have chemical restraints as well. And that just means that they give them a sedative so that they calm down she said it can be up to 24 hours, which it seems like a long time, but they do that sometimes if it's a dire situation. She said that the medical side is more satisfying and it's more learning and experience gathering, because she said it like as this. She said that it's like solving the pieces of a puzzle. You don't know exactly what's wrong yet, so you have to figure it out, and you have to work with the doctors and nurses to figure out what's going on, and when you figure it out and help the patient, it's much more satisfying. She said some of the most stressful things about her job is, especially when she's a lead EMT, and this just shows me that she is a really good EMT, because they only pick the lead EMTs if they show patterns of very good behavior and they're doing their job very well, and they only have a select few amount of people for the EMTs that can qualify for the lead EMT position. And she does say that it can get very stressful and dramatic when other people don't get to get that slot as lead EMT. She said that some of the more intense things are when people have heart attacks in trauma bays. She has to do CPR, and she said that she's done CPR for up to an hour at one point, and to do that you have to break the rib cages, which I didn't know, which is kind of scary, but it's good information to know, not just finding out on your own. In her 4 years as an EMT, she's only experienced 3 deaths, which could seem like a lot, but in 4 years that's not a lot, especially since she works there full time. One of the hardest things she has to deal with is dealing with the families of the patients, especially when the patient is in a very bad situation. She is the one who has to go and tell the family about what's happening to their loved one, and that can be very hard because it can involve a lot of crying and stressful situations and stuff like that. And that was the main part of our interview. At the end, I just asked her if she wanted to wrap anything up, give me any advice, since I'm going down the similar path that she went down. She said that SLIC is a great option. This is a great career to go down, especially in this whole COVID situation. We are considered essential workers, so we wouldn't ever have to worry about not having a job. There is a high success rate at SLIC, which is one of the reasons I explained earlier. She also said that since there are different types of EMTs, she said that the one that she is in the emergency room is more educational and learning oriented than if you were to be on an ambulance EMT, because they only can do a certain amount of things to keep the patient alive on their way to the emergency room, and then when they get to the emergency room they actually have to do a lot. Yeah, I think that was the gist of our interview. It was a really great interview. I think for my personal interviewing skills, I could have planned more questions in advance. I definitely got to about 30 minutes and I ran out of questions, and I thought that it was going to be longer, which I also told her, so I had to improvise some questions at the end. But actually, I think that the improvised questions at the end gave me better answers, and at one point she actually said that was one of the best questions she's ever been asked as an EMT, and it was one of my off-the-rail questions that I hadn't planned on asking earlier. Yeah, she said that being an EMT is much more educational and will prepare you more for if you're being a nurse, which I'm planning on doing. Overall, I think this interview went very well. Yeah, I wouldn't change much other than maybe preparing more questions. Yeah, that's it. Thank you.